it's hard to know the history of the mom's telling you, because when we ask her how long have they been breathing like this, she says since they were born, and they're what, 2 months old, and there's no way that they have been breathing like this for the last 2 months. So it's hard to get a history. Yes, she says they're full term, and we don't think so. We're not trusting the history that we're getting.
These are a set of twins. They're 2 months old, and they came in just complaining of vomiting, but it turns out that they're breathing way too fast and their heart's beating really fast, and if they keep that up they would just wear out and eventually stop breathing because they're working too hard to breathe. The older lady says she's the mother, but we're just wondering if the younger girl might be. She's just seems more attached to them and more upset. They also said that the babies they're twins and that they were full term, but just by the size of them, we're just not so sure that they weren't preterm, which could make some more complications. The good thing is their heart sounds good and their lungs sound good. We didn't hear any abnormalities there, and there's not really anything we could do for them right here. They really need to be in the hospital.
We just bring the patients in and check their eyes to see if they need glasses. A lot of our patients have itchy, dry eyes from the wind and all the dust up here, so we give a lot of them artificial teardrops. A lot of allergies too, so we give a lot of allergy meds. But that's about all.
She got her finger cut in the machine that takes the peel from the coffee bean. She accidentally put her finger in there, so it got cut. This is about 3 weeks ago. So there's not a whole lot we can do, but I'm going to have the orthopod take a look and see what he thinks. So vamos a ver.
The tendons function, she has no epitrochlear node, so I mean, it'll probably be fine, but I would cover her 10 days of antibiotics. I think it's going to be fine. I mean, she doesn't have a felon or anything like that.
Okay.
She has no epitrochlear.
This little girl is 8 years old, and she was, as far as I can tell from the history, she was born probably with a defect of the spinal cord, something like maybe a myelomeningocele, which she had repaired. She also has a shunt from the brain. One of the problems is that she doesn't walk, so mom has to carry her everywhere. So mom wanted help with a wheelchair. So that's what we're gonna try to see what we can do for her.
Her teeth are under the gums. But she's only 12. This one's coming in. See the piece of tissue here? Let's go over and ask her if it's all right to take 3 teeth out. One's coming with. This one's going okay. It's just they're coming out easy. It's just that she's hard enough. Got a lot of infection, but we're getting there. She's great. Some of these kids are as stoic as can be, and she in particular is. My number, and she never budged, did she?